Well, everyone, thank you so much for joining. We're really happy to have you here on this Thursday. I think it's afternoon everywhere except California or Hawaii if you happen to be there. But as you know, we will be diving right in to talk about students' persistence and how the link between mental health support really can foster student success, with a specific emphasis on how we can foster cross-departmental collaboration to better that. I see someone raise their hand. Haley, if you don't mind helping them with that, and just ping me directly if anyone needs any technical assistance or anything like that. But to give a quick overview of where we'll be going today, first we'll be introducing ourselves, and then through some live polls, we'll learn a little bit about you. Thank you again for all the activity in the chat thus far. From there, we'll talk about some current behavioral health trends as well as historical and how and where we're going. From there, we'll talk about cross-departmental support and how to garner it to get ahead of some of these challenges, jump into outcomes, and then round out with some conclusions and take-homes. But with that, I think it's really helpful to tell you a little bit about us, so we're not just talking heads floating on your screen wherever you're coming from. So my name is Dr. Nathaan Demers. I'm a clinical psychologist, but a few aspects of my identity that are really important and landed me in a somewhat of a non-traditional career. I am the father of two, a very passionate outdoors enthusiast. I've been a very competitive soccer player, and I grew up in a multicultural household with the maternal side of my family coming from India. And all these aspects of my identity have really helped me push outside the traditional confines of traditional behavioral health care. I did work in college counseling. I have worked as a clinician for a number of years. And oftentimes, with a lot of the challenges we'll be talking about today, I just asked myself, how can we do this better? How can we think about this differently? And how can we push farther in different ways? So those are aspects of my identity that have got me here today. And I'm going to pass it over to Ed to introduce himself.
Hi, my name is Ed Venit, and my background professionally is with EAB, where I've been for about 17 years. I'm our lead student success researcher with our technology products, Navigate, Starfish, and Edify. And we have just done a tremendous amount of work in this space, and we've gotten to know Mantra over the last few months. We'll talk a little bit more about that as we go. You're seeing some dinosaurs here because I am a paleontologist by training. That's what my doctorate is in. Less applicable than clinical psychology, but still pretty fun. And so those dinosaur footprints you see in the lower right are actually from Colorado, near where Nathaan lives. And then the bridge from Washington, D.C., where I live. So a little bit of background there. I'll be providing some subject matter expertise around the broader field of student success and linking it back to mental health.
Thanks, Ed. So something I forgot to say, I thought it was implied, but I should say it. I'm the Director of Strategic Partnerships with Mantra Health. And Ed, I think you and I both share paleontologist to EAB, clinical psychologist into the tech world. You know, there's no linear path within our careers.
Everybody comes from somewhere.
Absolutely. And Marybeth, I'd love to kick it over to you.
Okay, I'm Marybeth Murphy. I have been a vice president at two institutions and an assistant vice president at two other institutions. So I'm the practitioner. I'm the person sort of on the ground who's been where many of you are. Right now, I'm acting as a strategic advisor to Mantra Health, taking all the experience I have working with teams in student affairs and counseling and enrollment management, and hopefully giving some advice that is very practical and helpful to all of you. You're seeing some pictures here, some of my very favorite things. My son, being a parent is one of my passions. Some of my wonderful colleagues, the cookies that I'm known for baking, and also my love of museums. You see me there in front of the Met Museum. I live here in New York. So I'm really passionate about mental health and about finding new ways to serve students, especially in this new time that we're in, trying to help students on campus. I'm thrilled to see so many of you on the webinar.
Awesome. Thank you all. So rounding the corner, we'd love to take a couple minutes just to learn a little bit about you all. I just dropped a link into the chat. I hope that got to everyone. If you click that link, it'll open up a new tab. You don't have to input your name. You can just skip that. But we would love to use this polling software throughout the presentation to ask a few questions, make this a little bit more interactive. So I'm hoping that went through and that we will start seeing. We got our first, whoever it was, great work. And they should start pouring in as they get going. If you're having any challenges with this, please feel free to type in the chat and happy to help out. Normally takes a minute to get going, and then we'll see tens, if not hundreds of dots come on in here. For those of you who are having difficulty clicking it, I'm just going to reshare it one more time. The other thing you can do is copy the link and paste it into your web browser, if that works. Nancy, coming from Littleton, Colorado, I'm in Golden, so I think we're probably like 15 minutes away from one another, which is awesome. Great, there we are. I think people are coming in. Christy, I'm really sorry, and if you'd like to participate, feel free to use the chat. So we totally understand technology is awesome when it works, and it doesn't work every time, so I apologize for whatever's happening there on your end. But looks like we're getting a good hunk in here. Sorry for those of you that it's not working. Again, I'm not sure. HIPAA compliant Zoom doesn't allow for that. So I can understand that. If you'd like to manually type that in, polev.com/Nathaan Demers 329. I know it's probably longer than you want to do, but you are also welcome to do that. So with that, seeing we have a good hunk of respondents coming up on 100, which is about half. We have another sort of warm-up question here. I'm going to jump into that next one. So we're talking about mental health. Would love to just check in. How is everyone doing today? Again, this is anonymous. It's okay to be honest, no problem. But I think all too often as professionals in this space, a lot of times we forget to check in with ourselves. And I feel very strongly that if we are not our best, we cannot support our students to the best that we can. And I appreciate folks' honesty. I'm unfortunately seeing a hunk of folks falling in the not so awesome category. With a wide range of responses, but hopefully people are feeling okay. Also seeing some nice curious and proud and exciting, and we are admittedly in the thick of the semester, which I worked with a great executive director at a large state school who said this from here on out is when the wheels start to fall off the bus, and we're all just kind of hanging on through the end of the semester. So I think some people are probably feeling a bit of that. So thank you. And it looks like we have a lot more people getting in successfully. I'm seeing over 160 coming up on 170 responses. So awesome. So jumping to our next question here, when my screen decides to jump, I know a lot of you typed in where you're coming from, but would love to know what type of institution you're coming from. This can be really helpful for us as presenters in our talk tracks. So thank you for doing that. And I nerdishly really love see these bar graphs populate. I don't know about you all, but I think it's pretty cool. So a lot of folks from state universities, private universities, this all makes a ton of sense and largely what we were expecting. And I think it's really interesting for you all to know as well who your peers on this call are. So awesome. And now this last one's a quick type in. You don't have to type a novel, but would love to know just what is the biggest challenge that your campus or system faces in terms of supporting student mental health? And I know we're going to get a wealth of answers here. We might not be able to go through them all. So again, feel free to just put in a couple of words. So scalability, lack of staff, access to students. So interesting. So thus far, our co-presenters, please feel free to jump in, but we'll be addressing a lot of these topics already, which is great. Attack on DEI work. I was just co-presenting at NASPA with an institution from the state of Wisconsin, and there admittedly are some challenges, as folks know, with state legislatures taking a lot of different approaches to a lot of that DEI work. Loneliness, lack of resources and financial backing, getting students to engage with mental health resources. Great. All right, I know there's probably a wealth more that did not make it in, but I think we're starting to see a little bit of saturation with engagement, funding, resources, as well as something related to either stigma or engagement. So thank you again, and as part of the follow-up, we can make sure that this list gets distributed as well. So with that, I'd love to turn the corner and jump into some of our content here. And I'd love to kick us off talking just a little bit about the behavioral health trends at present and how this relates and necessitates, if you will, the importance of cross-departmental support. So I'm going to go through this somewhat quickly just because it's likely that most people on the call at least are vaguely familiar with this. All this data is from the Healthy Minds study, and the reason I have these descriptive statistics up here is I just really want to emphasize that this data is very inclusive. So seeing that we have folks represented from a number of different types of institutions on this webinar, you can see that this data is very much representative of a diverse student experience. So in-person, hybrid, online learners, a wide variety of different degrees. I do think that we really need to work on the abbreviation for associate's degree, but this is not my data, so I can't claim or be blamed for that. And then in terms of living arrangement, again, we can see that we have community colleges, commuter students, a lot of students living on campus and otherwise. So to jump into the data, and again, I'm sure you all know these reports, we could do a full 90-minute webinar on behavioral health trends, and my co-presenters and I did our best to pull together a few points that can really illustrate, again, the importance of working cross-departmentally nowadays. So this is a question about students' knowledge of mental health resources on campus. And overall, this looks pretty good, but when we add up all the students who disagree to strongly disagree to knowing where to turn if and when they need mental health supports, we're unfortunately seeing that about 19% of students are saying, I don't know where to turn if and when I need support. And again, the idea of 1 in 5 students saying, I don't know what to do when I'm experiencing mental health is far too many, in my opinion. And again, this is in spite of us working really hard as institutions to increase the awareness and visibility of supports on campus, especially since the pandemic. So secondly, when students are asked, what percent of students or have you actually accessed mental health support, formal mental health support, which can be a lot of things, in the past year, we see about 36% of students endorsing yes on that. Which on one hand, this is an awesome statistic in that we are seeing more and more students are indeed connecting with mental health services. Where this gets challenging, and there's obviously a lot to unpack here, we know some students, many students are actually coming into college having previously seen a mental health provider. Some continue working with that provider. But where this gets even more challenging is we know the average college counseling center can see between 5 to 15%. Some that are really pushing and innovative can see about 15% of their student body. So what this means is that we are really bursting at the seams in terms of being able to meet the demands of students looking for mental health support on campus. And then to round this all out, when we ask students within the past year, could you have benefited from formal mental health support for feeling any sort of mental health challenge, including feeling sad, blue, anxious, nervous, or depressed? And when we do that, we unfortunately see that about 57% of students are endorsing, yes, I could have used some support. So again, this is not perfect math. This is not, overly scientific. But when we look at this Healthy Minds data and we say 57% of students said, yes, I could use some support, 36% are saying, I got support, we again see that about 20%, 21 specifically, percent of students are having their needs going unmet. So with that, again, it's really speaking to the need to work cross-departmentally to get upstream and be able to reach more students earlier in their educational and mental health journeys. So with that, I want to kick it over to Ed to talk a little bit about this data more from the student success perspective.
Yeah, hi, thanks, Nathan. So my role at EAB is a bit ironic in that I have studied the past until now, and now I am studying the future. I've gotten some experience in the world of strategic foresight, futurism, and we've been looking at trends for what will affect student success for the next decade. Mental health is very clearly one of those trends. So Nathan presented kind of the point in time right now. Let's back up 10 years and see how things have changed. 2013 to 2023, you saw a doubling in anxiety, depression, use of therapy, and a ton of other statistics associated with mental health. What's going on here? Well, it could be a couple things. Gen Z is famously incredibly attuned with their mental health. They are destigmatized more so than any prior generation, and they're really comfortable talking about this stuff, and they're quite sophisticated. So they're making better use of the services than any prior generation. The second problem here is they might actually have more challenges. And across this period of time, you've seen the world get, a bit stressful. And it's also correlated, of course, with the rise of social media. So there'll be dissertations written about this for decades to come, I'm sure. But there's clearly something going on here. The impact on student success is worth noting. So if this trend is moving like this, well, how much does mental health impact students' ability to complete college? Well, we got some data here from Illumina and Gallup. They've actually been conducting this survey for the last 3 years. Traditionally speaking, those in the student success profession have looked at 3 different things as reasons why students typically leave school, and they're pretty unsurprising: financial, belongingness and fit, and of course, academic ability. So, can you pay for it? Do you belong there? And are you doing good at school? And those have been reasons why students would leave school in the past. And of course, it's why what institutions are set up to support in terms of academic support, financial aid, you name it. The mental health challenge has eclipsed these, as you can see from the data here on the right side of the page, with the dark bars being bachelor students, the light bars being associate students. The coursework too difficult, cost of attendance, skeptical career value, those are all still there when we look at and when we ask students why they would consider stopping out of school. And this was, sort of a stop out in the last 6 months. Why had you considered it? These were the normal reasons. But then look at these 2 that are up here. It's emotional stress and a prior mental health diagnosis. These things have eclipsed all these other reasons for why students might consider leaving school. It's pretty notable because clearly something is going on here that we need to address from a student success perspective. But unlike the financial, academic, and belongingness, it's not something that the larger student success community has been working on for decades. So we don't quite have the full infrastructure, strategy pieces, and investments in place to really address this challenge right now, which is one of the reasons we have this conversation here today. We'll be hearing more from Marybeth in a moment to hear a little bit about how this plays out actually on the ground on campuses. We can look at the numbers, but it's a much different story when you actually are physically there. But it's pretty clear there's something going on here that we need to address if we want to support students fully to graduation moving forward into the decade.
Thanks, Ed. And I think something we all know, change is hard. Changing culture is hard, and changing systems is very hard. So with that, and with this dramatic rise, one thing that we've seen is, again, these trends have been ticking up over the last decade, but COVID really exacerbated and poured gas on this fire of specifically point solutions within the space. And I think the stat is $4.5 billion was invested into the digital behavioral health tech space. There we go. I got it. From 2021 to 2023. And with that, it's great in many ways that there is a large increase in the diversity of programs available. Where this also gets a little bit stickier is there are a lot of questions about quality. The way that there is a licensing board for myself as a psychologist and other mental health providers, there isn't for digital health tech tools, if you will. Then additionally, providers on campus, and Marybeth, you can very well speak to this better than me, but you all have a wide variety of responsibilities, and all of a sudden, you, on top of everything that you're doing, oftentimes have to be vetting a lot of these behavioral health tools and then finding ways to integrate them into your campus programming. So despite this vast increase in this, we also have a number of challenges, which I'll get to in the next slide. But Marybeth, I wanted to pause to see if you have anything to add here from your perspective.
Yeah, I mean, what's interesting to me, especially interesting, is I looked at that 10 years that Ed talked about. And in 2013, I started as a vice president in a new role, enrollment management and student affairs. And during those 10 years that I was actually there for 8 years, I saw very clearly the increase in students' emotional mental health needs. I mean, we were trying to hire more staff, we were doing outreach, we were, trying everything we could think of. And we did look into a number of these different solutions that, and tried to cobble them together. Different training solutions. I recognize so many of these: Active Minds, Jed Campus, Cognito, and I'm sure many of you know them as well. But somehow that kind of overloaded students, right? And faculty and staff trying to figure out, where do I send students? How do I find the right resource for them? So while everything has been well-intentioned and there are a lot of really good things on the market, I think it's been really challenging for those of us who work with students and work with staff and faculty to find the right solution. So, I mean, it's really been a challenge. And I think, we're going to bring to you a few solutions here, not all the solutions. We're all in the midst of this struggle, but I think there are some solutions that we can share with you.
Yeah, thanks, Marybeth. And that really leads really well into this of, despite this dramatic increase in services offered on campus, that are in theory, scalable, they're upstream, that students should connect to, we still see a number of barriers to connecting students with these supports. So from a faculty and staff perspective, obviously there's more than listed here, and we're going to go through them pretty quickly. But to highlight a couple, first, when it comes to time, we know faculty are already working extremely hard. They have a full-time job, and then they're being presented with student mental health on top of what they're already trying to do. And they have time constraints to be able to support students in the way that they might wish to. Additionally, oftentimes faculty and staff can't keep up with all of the digital resources that are on campus. They're already, grading, doing all the work that they're doing on a day-to-day basis, and then they just don't have the time, availability to be able to dive into everything that's offered on campus and know the nuances between the difference between an online CBT module, for example, and what students should be referred to the counseling center. We also know from Healthy Minds data that about 84% of faculty and staff are saying, I'm being confronted with mental health in my office one-on-one that I have not received adequate training for. I'm not a trained therapist, and I unfortunately feel uncomfortable talking about this with students. And then additionally, that very much relates to stigma. So both stigma on students' perspective, which still unfortunately does exist, despite, again, what Ed was mentioning, that Gen Z is much more in touch with their mental health, there still are a lot of pockets. And again, when it comes to faculty and staff, they might have their own experiences with stigma and discomfort around talking about mental health, both their own as well as students. And then these last two are very much interrelated in that we know, unfortunately, many counseling centers have been forced to work on wait lists. I know when I was a college counselor, we had about a 4-week wait list, which was really, really difficult for a number of reasons. But with that, if I'm a faculty member and I call the counseling center trying to make a referral and I hear it's a 4-week wait list, I'm unlikely to make that referral again, unfortunately, because my student needs support right now. I'm here and now with them in the moment. So that can be a barrier. And then in the absence of streamlined referral processes, unfortunately, faculty and staff feel the need, or the only way to actually close that loop is to stand up and walk with that student to the counseling center and actually connect them. I have heard some great anecdotes of some awesome referral protocols and things like that implemented at specific campuses. But again, doing so at scale and having things that have a single entry point can go a long way. Co-presenters, anything to add here?
I can just say that in my role, I heard so often from faculty members whose office hours became, they were very used to office hours being, how do I pick a topic for my term paper, or, how can I think about what courses to take next semester. But instead, they were listening to students' anxiety and stress and just feeling very overwhelmed by that. So I think we're seeing a new reality here where students go to many different places on campus and share their stress and anxiety and worries. And so we need to really be thinking about how to help them in these different locations that they may come to, rather than just going to the counseling center.
Absolutely. Thanks, Marybeth. Then just to flip it, and I'm going to go a little bit quickly because I think we all have lots to share and talk about through here, and I want to make sure we get to the meat of our presentation. But when we talk about barriers from the student perspective, I've heard one of two scenarios that resonate most with campus administrators. And one is a lot of times students don't feel like they have visibility into the services available on campus. And what I mean by that is there's a lot of services. Maybe you work with a telehealth provider, upstream mental health app, you have your own counseling center, there's wellness workshops. And advertising those or getting them in front of students is really difficult. And we know that 50% of students who stop out due to a mental health condition have actually never accessed supports on campus for that condition. So this is a large percentage of students that's saying, I didn't know it was there. But then on the other side, we do also have students who are just confronted with information overload. We know everything's at their fingertips. We know students, unfortunately, at many campuses are tuning out of emails. Sorry, I just had a pop-up that came up on my computer. I was hoping it wasn't going to force restart. I think we're good, but if I disappear, that's what happens. Sorry. So with information overload, students often can be confronted with a bit of decision paralysis. If I'm anxious, stressed, depressed, unsure how I'm feeling, if I don't know whether I should go to the counseling center, a third-party provider, a community provider, talk to my primary care doc, or anything in between, that can actually be a barrier to connecting with the next level of support. So would love to just jump back to the poll really quickly, and I just dropped that link back in the chat for those of you using non-HIPAA compliant Zooms, which we learned today. And just genuinely curious, does your campus offer any of these third-party mental health solutions on campus? And there's going to be one more poll right after this, so please keep this open and available. Also, a large number working with teletherapy or telepsychiatry services, but a really nice diversity of services here. Ed and Marybeth, interested in your take on this.
I mean, this is what. Oh, go ahead, Marybeth.
No, I was going to say he called on both of us. I was going to say this. I think this makes the point that we're using lots of different tools, right? And many of them are sitting on websites and workshops and in different places, but not necessarily coordinated in a way that where students can kind of go easily to get the kind of help they need. I think what it shows too is an incredible amount of effort that everyone is putting in, and the concern that people have about this. You really don't see. You see, I think what you see is us, kind of throwing everything at the problem, right? And I think that can be very good, but then again, that photo of the student kind of not knowing where to turn, I think that it shows that issue pretty graphically.
Definitely. And Ed, feel free to respond while we're getting responses to this question. But our next question is just, are these tools that you have embedded in student success initiatives? But Ed, I didn't mean to cut you off and not let you respond to that first question either.
Oh, no problem. What I saw in the results was a shadow, if you will, of the capacity challenge, but it's being solved with more humans rather than scalable things like student coaching or self-direction or things along those lines. It's a sort of we don't have enough people, let's plug them in. So right. What that raises for me is a question which you would both know better than I would, which is, well, is it because humans are that necessary and we absolutely need to do that? Or is it a reflection of legacy thinking where, well, there's only one way to do this, so we only do it one way, and we don't really think outside the box. Not a practitioner, obviously not my realm, so I couldn't answer that one way or another, but that's what I was thinking about when I looked at the numbers.
Yeah, that's a very fair point. And like everything, I'd say it's probably a combo of the two, and the truth is somewhere in the middle there. But just to address this, first off, great to see that a large percentage of folks are endorsing that their campuses do embed their mental health initiatives within student success initiatives. We do see a little bit that haven't, and a lot, and this is actually where I see most responses when I ask this question of large audiences of in theory but not in practice, or I just don't know. And I think when we really focus, we have, just over 50% falling into that camp. That's the whole point of this webinar. This is where we want to talk about cross-departmental support and how models of stepped care can help overcome a number of the challenges we just talked about. And with that, I'm going to kick it over to Marybeth to share some from her experience and expertise.
So I get to talk about silos, which is something we all experience in higher education. And in many other parts of our lives, right? Like the healthcare system, there are many siloed organizations that we have to deal with. And some of the reason we have silos, of course, is because we have expertise kind of in each of the silos. And so, for instance, I started my career as a financial aid counselor. So I lived in one of those silos for a while, learned a lot about financial aid, became an expert in financial aid. And, that's where you have to go if you need to learn about filling out the FAFSA, right? You don't go to counseling, you don't go to your advisor, you go to financial aid for that help. So there is a necessity for some specialized silos that we all work in. I think the problem we run into is students, we have so many students now with mental health, emotional, psychological issues, stress, and anxiety, that they're kind of spilling out of the counseling silo, and they're everywhere on campus. Students are going to academic advisors, they're going to faculty, their emotional needs are being shared with many people on campus who aren't necessarily sure how to help. And where do I send this student? And I'm not really qualified to decide how serious this issue is. And so we're seeing students who may not be getting the help they need because they are kind of going through the wrong door, right? And the more doors students have to go through, the more likely they are to give up, right? Because I don't know where to go next. Nobody can help me. And, students who are in distress aren't always thinking as clearly as we would like them to be thinking. So it's really important for us to find ways to connect the silos. We'll never get rid of the silos, and I don't know that we necessarily have to get rid of silos. They serve a good purpose, but we need to figure out a way for students to get the help they need and not get this kind of run around, pushed from office to office, or just, feeling like the institution doesn't really care. So I think on the next slide, you'll see a little bit of data that sort of supports what I'm talking about, which is, academic advisors are one of the few groups that meet one-on-one with students, right, each semester. And a lot of times their emotional issues or their anxiety surfaces at that time. 80% of the faculty and staff say that they have conversations with students about mental health. That's an enormous figure, right? I mean, and I was hearing that more and more from faculty and staff. And also the next one, that is, supporting students in mental distress has an impact on the people who are doing this. So it's really something we're not prepared for. And in many ways, it's not something we could have been prepared for, right? I mean, you look 10 years ago, we didn't have the same number of students coming for this kind of assistance. So we are playing catch up a bit and trying to think of different ways to solve these problems, to get support for students, and also to support the staff who's working with students who are feeling overwhelmed by the needs of students who come before them. So the other thing I want to mention is we can use some of our technologies to help us. So many of you on your campuses have CRMs, and so that's a customer relationship management tool, and you can use that to connect with students. You'll hear a little bit more later about EAB's Navigate tool, which is a CRM where you can communicate with students much more easily. Almost every campus has a learning management system. An example is Canvas. Students use a learning management system for their classes. You can post information there. You can direct students to many of the resources you have on campus. The one thing I want to caution people, though, about putting a lot of this information on your LMS or CRM, you have to make sure you have capacity on the other side of this, because you do, when you put the phone number of the counseling center on your syllabus or on your LMS, students will call. And so you have to make sure you have the capacity to help them. So I think we'll talk more about building capacity, but there was an article in the Chicago Sun-Times about a student who, kept seeing on her syllabus where to call for help, and she kept getting voicemail and nobody returned her calls. So we have to really think carefully about not just putting the name of the resource on our websites or on our CRMs or LMS, but making sure that when the student needs that service, that there's capacity there. And the last thing I'm going to say is just some strategies to support cross-departmental collaboration. This is hard, I will tell you, having worked in, 4 institutions, public, private, large, and small. This is not an easy thing to accomplish. It is very helpful if you have top-down support from the president and provost, who are committed to making sure that the different areas of the university speak to each other, collaborate, and provide opportunities for that. For instance, providing opportunities for people to go to faculty meetings and meet the faculty, all different ways to make sure people have time together to get to know each other. And then there's also the informal channels, right, where staff connect with each other. This has become, though, really interesting as we have so much hybrid work, how we figure out how to connect with each other when people are not in the office every day. So these channels that we used to use, which is, informal channels, meeting people in the hallway. They don't work quite as well if people aren't actually in those hallways every day. So one thing we have to start looking at are other strategies, other technologies, different ways of thinking about connecting with students. Training for faculty and staff, I think, is really critical. It has to, and not deep training about, doing your own therapy for students, but, what to do when presented with a student at your desk who's upset, crying, needing someone to talk to. And there are some good trainings out there. One, I will just mention one that I have used, which is called QPR, and it's question, persuade, refer. And it just gives you a few little tools to help you get students from the stage of being upset and in distress to getting them referred to the right person. I also think if your institution is one that is very serious about strategic plans and goals and individual goals, make sure that these cross-departmental collaboration in a very specific way are in those plans and goals. When I was a VP at Fashion Institute of Technology, one of the goals the president put in my performance evaluation was that I had to collaborate with the VP for academic affairs, and we had to have joint staff meetings, and we had to make sure that the people in both of those areas knew each other and could work together. And the last thing I will say is, if you are going to invite people to meetings, make sure they're focused and short and interactive. I have been to, and many of you in higher ed have too, been to many sort of pointless meetings that aren't well thought out. We've wasted, you've had your time wasted. If you're the one convening people and talking about student success, be very respectful of people's time. Figure out a way to have a really good meeting. I know that almost seems like an oxymoron, but find ways, to give people information in innovative ways and give them time to talk and ask questions together. I just think it's not something that comes naturally, and I just think it's something to become much more expert at. The other thing I would say, and to lead us into, what we're going to be talking about next, is I think it's time that we all really look at new ways of doing things, more innovative, looking at technology, looking at meeting students where they are. Many of them are on their phones, many of them are on apps. And are there ways we can provide services, maybe more upstream services so they don't necessarily have to come and have therapy? Are there other ways we can look at the problems that we're facing to provide students the support they need? But many people have said we can't necessarily hire our way out of this. I mean, we just can't have the whole, we can't hire as many counselors as we have faculty, right? So what other things can we do to support students? And I think we have in our next couple of slides some suggestions for all of you.
Yeah, thank you, Marybeth. That experience on campus is so helpful, and I appreciate the transition into this. And I've been doing my best to monitor both the chat and the Q&A, and I actually think this is going to answer a lot of the common themes around capacity, how to get buy-in from non-clinicians, if you will, when it feels like clinical intervention should be owned by the counseling center. So this is our model of whole campus care, which is a stepped care approach to behavioral health care. And what is so important about stepped care is it's all about connecting students with the right level of care at the right time. Historically, I've found that anytime a student's in tears, they would get referred to me as a psychologist. But oftentimes that student might be in tears because A, they don't know where they're going to sleep tonight. First off, I'm not the most appropriate first referral. Let's figure that problem out. And then I would happily support that student, of course. But secondly, we often have times where students are anxious, overwhelmed, because they're lonely, they're not sure their major, they're having difficulty connecting. And those are all opportunities that don't necessarily need to be supported by a clinician. There's a number of other levels of care that can support. So that's what this model's all about. So within this, you'll see that there's three main buckets, if you will. There is promotion, prevention, and intervention. And to walk through each of these, I'm going to do it at a pretty high level because I'm seeing a lot of questions coming in. But starting over on the left hand of our screen, we have scalable DBT, which is dialectical behavioral health therapy, not behavioral health, behavioral therapy. I just added an H into DBT for no reason. But what these are self-care modules that can be administered independently in about 5 to 8 minutes for students on their own. And the beauty of this is that while it is a clinical intervention, it is evidence-based, it feels much more approachable for an academic advisor to assign a student a quick module on time management, mindfulness, or making relationships. That feels very different than saying, hey, I'm going to try and do therapy here. So when we're able to embed these tools in upstream services like LMS and CRMs, we can get students at scale and ideally increase baseline resilience. The next level of support is we have a peer support community through a relationship with Togetherall. Togetherall is an anonymous clinically moderated support network. And oftentimes, again, going back to that student who's a little bit homesick, they haven't figured out their major, they feel like everyone else has it all figured out. That student might just need to connect and understand that they're not alone in their experience. And here's some other ways that other students overcame those challenges. So another great way to scalably connect students, and again, this falls a little bit more in that non-overly clinical bucket, so it can be more approachable for an academic advisor or a resident advisor to make that referral. Jumping up our support continuum, we also offer a service called Connect Now. And what this is oftentimes a student might be in a crisis because they just failed the test. They're worried about losing their scholarship. They don't want to call 911, 988 or a crisis line because they're not about to hurt themselves or someone else. But they also don't want to wait a day, 2, 3, 4, 5 for an intake. So what this allows students to do is actually connect with a clinician within 10 minutes or less and engage in some solution-focused work to be able to support themselves right then and there. All of our services moving up here are wrapped around by navigation and triage. So if students don't know where to start, they can come into our platform, take a quick assessment, and then be connected with a recommendation for care or actually connect with a human who can best understand what they're experiencing and make a recommendation. Moving up our continuum, we also have emotional wellness coaching. This is incredibly impactful for students who, again, don't have clinical challenges. They're not diagnosed with depression, anxiety, or another condition, but they are feeling homesick. They do need a little bit more accountability and someone to help support them through the everyday stressors of their college experience. And then, of course, in the intervention realm, we offer clinical care that very much works in collaboration with existing counseling centers. That includes therapy as well as psychiatric services. I'm going to be very quick with these last two. We also offer specialty clinical care for students who need more support than an individual one-on-one therapy can offer. So we have a unique and proprietary relationship with Charlie Health, which can connect students to care virtually, which is a huge benefit because most often students actually have to pick up and move closer to a intensive outpatient provider. Being able to do so with Charlie Health and do it virtually allows students to oftentimes stay in school. And then we also have 24/7 crisis support. So that is essential in any care continuum. Students need to be able to connect if and when a crisis occurs. And we, of course, relay all that information back to the institution so that they can make sure students are being flagged on any students of concern teams or anything like that for continuity of care. So I want to pause. It was a lot and just see if my co-presenters have anything to add before I jump to this next slide.
I mean, one thing I just wanted to mention that when I first saw this slide, I thought students would necessarily might go through all the different steps, but that is not really how it's designed. You know, there might be a student who just needs peer support through Together All, and that's all they would access from the continuum of care. So I think what we're seeing too is that there are many students who really have what I might think of as sort of normal anxiety, right? Anxiety before a test or homesickness or, you know, worry about family members or worry about the future. Those don't always need a clinical diagnosis and a therapist, but you do need somebody to talk to. And I think what I find really most helpful about this model of care is that you can get some of that more quickly and easily without necessarily going through the process of getting therapy. So, but of course, what's great is that therapy is there, as well as usually psychiatric care, which can be hard to access in many parts of the country. So I think it's, as a vice president, you know, when I was looking at all these different solutions, having this type of comprehensive care is something I would have really appreciated.
Yeah, thanks, Mary.
What I had is link it back to the larger student success strategy. So if you're looking at a step care model, you're looking at a continuum of intensity, but also on the left side, you'll have sort of broader services. On the right side, you have more acute services. For those of you in the student success space, especially those who have worked with EAB, you might have heard us use a term population health management, which we've you know, sort of shamelessly stolen from the healthcare industry. And it's the same kind of concept of you've got a small number of students who need intense care, a large number of students who need scalable, broad-based care, and then a group in the middle that kind of can go either way. And it's about monitoring. So if you're familiar with that kind of pyramidal model where you're deploying your resources in different ways, this is just this, but for mental health. And again, applying scalable, broad-based resources across as many students as possible, and then deploying your acute resources where they're your expensive resources acutely where they're needed, I should say. So we found a lot of success with this, with things like just academic support, you know, tutoring, things like early learning systems in classrooms for students who might be failing their courses. And so when we started seeing step care models, we're like, hey, we already know what this concept is. It works really well. More people on student success teams need to get exposed to this because they're going to intuitively understand what it is. And that's actually really played out. So, yeah.
Thank you. And building off both those comments, the other nice thing about stepped care models is it makes a no wrong door approach. So whether students do show up to the counseling center and get referred to self-care modules, they hear about it from a faculty or staff, because again, that faculty or staff member doesn't need to know about all these services on the right-hand side. They just need to know, oh, you're experiencing some mental health challenges. Let me refer you to Mantra. Students can find out directly about it through marketing efforts, or as we've been talking about, through linkages in student success initiatives. Say that 10 times fast, which can go a really long way. And when it comes to campus activation, this again links back to something that Marybeth was talking about, and we'll transition to Ed in just a minute. But when we launch these tools, we have to make sure that we are working cross-departmentally. So being able to get in front of students across campus at scale through email and marketing materials, social media campaigns, digital and physical campaigns, as well as looking at SEO to make sure mental health is populating appropriately. And then again, the crux of this presentation is the benefits of being able to integrate it with LMS and CRMs, because again, those touch each and every student on campus. When I come on board, more often than not, I'm going to be using my LMS on a weekly, if not more often basis. And Ed, I'm going to kick it to you to talk a little bit about Navigate.
Yeah. So I don't know how many folks in the audience are in the student success space or have familiarity with either Navigate or Starfish for that matter, or other student success technology. We work with about 850 schools, so I wouldn't be surprised if many of you are in the audience. Feel free to shout it out in the chat if you wish, if you know. That'd be nice to see. What's really great about Navigate is that it's a student success. There you go. And when I say Navigate, just assume I mean Starfish as well, because it can do all the things that I'm talking about here as well. So we got a lot of Starfishers in there. All right. It's a student success CRM. So, if you're familiar with CRMs, they are mass communication technologies that also sort of keep records and data for who all those customers, in this case, students, are. Our CRM can also do things like do polling and surveys, and we have modules that students can take during orientation, things along those lines. So it's a really great way to get all that stuff out, as well as third-party content like Mantra or something the school has developed. We can also push that information out to students as well. So it's a natural vehicle to link to some of this great work that Mantra's doing with the step care models and other support they're doing, because so much of it is student communication based. There was something else that we really liked about this. A lot of step care isn't HIPAA protected. It's sort of outside the clinical space. So you can do things with people who don't have those sort of the training and the privacy, garden variety of people who are working the student success space. So that was really encouraging. The last thing we really liked about this was we're already installed. There's 850 of you that have this technology. And a lot of the use cases you can literally do today. You can get off the webinar and start communicating with your students right now. So we love the fact that the tech was already installed, because as you can tell, this problem is moving very, very quickly. And it's not something you want to wait around a year or a year and a half for another CRM to go into place. So we're like, hey, we got a tool here that's useful for one thing. We can totally adapt it to another thing. And we should. And that's essentially kind of where we've been going down. You're seeing some of the early work here.
Awesome. Thank you, Ed. And just to very quickly show you what this looks like in Navigate. So being able to have a call out to Mantra right in the main navigation of Navigate, that's a little repetitive, but you know what I'm saying, as well as being able to integrate it into to-do lists, surveys, again, taking that population health approach and being able to touch each and every incoming first-year student or every student who has an academic advisor working with them through Navigate has tremendous potential to, again, get ahead of care that students might need and connect them to the right level of support. And when we've done this work, we've seen that we have been able to get tremendous uptake on campus. So this is one semester's worth, a case study that we did this fall. And you can see that when we work cross-departmentally, we're able to work with student success. We were able in our first semester to get almost 10% of the student body engaged in some level of care. Would we like to see that at 100% someday? Absolutely. But going back to a lot of our themes, we know that change takes time. And we see being able to get in front of 10% of students within a semester awesome and a great foundation to be able to continue building upon. So I'm going to go very quickly through here, and we're not going to have enough time to answer everyone's questions. There will be a quick survey after the webinar with like 3 questions and take literally less than 30 seconds. But you can also type in anything that we don't address there. But something I'd like to very quickly highlight is that when it comes to reporting, one thing that's important with stepped care is that you can have multiple stakeholders interested in this data. When we're just talking about therapy, that's data that the counseling center wants and often doesn't want other departments being able to check out. But when we're talking about referrals to emotional wellness coaching or our DBT modules around time management, all of a sudden, that's something that academic advisors are really interested in. A lot of RAs are interested if students are checking in on mindfulness, sleep tactics, and things like that. So it's a way to garner additional support and be a nice touch point across campus, semester over semester, being able to ask, how are we getting referrals? Where are they coming from? And where should we be bolstering our messaging? Anything to add very quickly, presenters, because I do want to get to our outcomes. Okay, thank you. So Ed, I'd love you to set this up for us.
Yeah, this is I'm going to give a little bit of behind the scenes stuff here about what was going on at EAB when we started thinking about the mental health challenge pretty seriously about a year ago. We took a couple different swings at it from a couple different ways. One of the things that we do around here is we like to understand what all the other vendors out in the space are doing. And in this case, we were looking at all the different mental health providers. There was one that stood out very much more so than all the other ones. And well, we're here today having a conversation together. So one of the things that we really impressed us about Mantra wasn't just the approach. The step care model was, as I've already explained, really aligned with our already understood philosophy. But the results data is just killer. As you're about to see in a moment, it's absolutely, really just, I don't know what the right word to use for it. I'm very excited by the results that you see here because it's incredibly effective, as you'll see in a moment, for getting a lot of the challenges that we're talking about here taken care of in a way that really helps students and has a very quantified, measurable impact on student outcomes. So it was really encouraging to see it work. It was also one of those moments where we realized we're not going to be able to do that. So we should partner with these guys, and here we are. So Nathaan, I love for you to sort of show what we saw in terms of how well this all works.
Yeah, happy to. Thank you. So again, going back to that population health approach, we see that the vast majority of students using our self-care are indeed saying that they are finding it helpful and that they're actually learning and gaining skills from it. You can see the most common completed skills there, including mindfulness, distracting your mind, which is stress reduction, as well as gaining focus. So again, population health upstream, very scalable. When we jump up to our coaching, we see that students are really satisfied overall with our coaching program. This is really important because there is a myth that all students want therapy, and there is a percentage of students who do want therapy, but there's also a great percentage who can benefit and will be satisfied with connecting with care through a one-on-one relationship with a coach. Jumping up into our Connect Now service, the reason I wanted to highlight this is that we see students overall are seeing a 30% reduction in their self-reported distress from the beginning to the end of that call. Why that's so important to me is that we know students have worries in the moment and we can actually address them. And when we ask callers, what would you have done without this service? 60% are saying they don't know or they wouldn't have gone anywhere. And that's the student I personally worry about the most because that's a student who is likely going to surface with higher acuity needs somewhere else. Going very quickly through this, because again, I'm so sorry I didn't do better with time management. In terms of therapy, we have a great satisfaction with our provider match. Students are saying that providers are helping me meet my goals. We're also expanding hours of services available, with students being able to actually connect with clinical care outside of traditional hours. Then when it comes to hard clinical outcomes, we see that 67% are improving with anxiety, 68% improving with depression, and 82% improving who entered care with severe depression. That one's so important because that's the student who's most likely to stop out or experience a number of negative health outcomes. But to pull all these things together, again, the world of mental health and student success, we also like to ask students, did the care you received in terms of mental health through Mantra help you remain in school and persist? And with that, we see 70% of students are improving at least 1 point on a 6-point Likert Light scale, and 62% are actually moving from a higher risk category down to a lower risk category. I'm going to be extremely quick with these take-homes because we're right at the top of the hour, and I apologize. But first, would like to just say that we are experiencing increases in student mental health that are indeed having profound impacts on student success. And when we look at models that can get ahead of capacity, integrated stepped care models can get in front of students who have lower acuity needs with scalable interventions while connecting students to higher levels of care who have higher clinical needs. And then third, we also have to take more proactive steps to get cross-departmental support because mental health is not only the challenge of the counseling center nowadays. As Marybeth and Ed really well pointed out, mental health is surfacing wherever students feel comfortable. Often that's with an RA, a faculty or staff member, or maybe an academic advisor. And we need to make sure that these folks have streamlined referral mechanisms to get students to the right level of care. So again, I'm so sorry we didn't do better, and I will take full responsibility of that to answer more questions. But again, a three question survey will pop up, and we can follow up with any questions that you have. I don't know about you two. I can stick around for a few minutes and try and answer a couple questions. But if not, thank you so much for joining. We really appreciate your time and interaction throughout the session. Great. Do you two have to drop right away, or do you have a minute or two for some questions?
Yeah, I
happy
can
to
stay.
interrupt.
Yep.
Awesome. Great. So I'm just going to open up these. I'm seeing a lot in the chat, a lot of thank yous, but let's see if there's any that rise to the top. And Haley, please feel free to throw out any questions that you've been tracking throughout. One I saw from Mark is capacity is a big concern of ours. When we send out surveys to students, mental, financial, housing, stress, I'm looking forward to suggesting solutions to grow our, we kind of answered that. Sorry, that's really all about stepped care. One question, do you have thoughts on collaboration with external partners such as county-funded mental health agencies? We have a statewide telehealth program that wants to work with students, but unsure that what that collaboration would look like. So it's a great question. I'd be more than happy to connect with you one-on-one to really get in the weeds of that. The biggest thing that I would recommend is making sure that that experience is streamlined for students. One thing we do at Mantra is train all of our providers on your campus culture and make sure that they're very aware of campus resources so that if and when that student brings up in therapy that they're having challenges academically, we can make a referral back to, for example, the tutoring center, the financial aid office. And in the absence of a relationship between an outside mental health entity, you can often have some pretty big gaps when it comes to that experience. But it can be a great way to support in the meantime. Another question, do students have to sign a release of info for their university in order to participate in all these services? Great question. So we are HIPAA compliant, and we also set up all the paperwork in terms of use, privacy policy, and all that as part of student onboarding. So that is all taken care of for students. They don't have to do additional paperwork, sign things, scan it in, and all that. Another question, is this long-term care? So we have multiple packages, which can be more short-term. We don't do like long-term care, meaning like forever, unlimited, but we do offer packages that have up to 12 sessions per academic year. Haley, if you see any other questions, I see our chat is giant, and I do not think we can conceivably go back and answer all those questions right now. Seeing one new message. Some folks are asking for more info about wellness coaching, so got it. So I'm happy to do a quick bit, and co-presenters, I'm sorry that these are all kind of addressed towards me, so sorry about that. But our wellness coaching program, again, is about 8 to 12 week program that, again, is all about increasing the accountability and the availability of a provider to be able to connect with the student in the moment. So in addition to ongoing sessions, that coach will also assign some of those DBT modules that, again, are evidence-based. And furthermore, there is asynchronous chat, so students can connect with their provider in a more of an ongoing way that, again, can be really helpful in increasing accountability. Another question, how do you get students to trust some of these resources? I feel like many students on our campus really enjoy in-person connection. I'll take that, and I'd love that to pass it off to Marybeth as well in your experience, but for me, having this institution really endorse a platform, A, first helps, but B, a way to bridge those worlds is when an academic advisor or a faculty member knows about a service and then makes that personal referral, who says, you know, I know about Mantra, I've had students use it and had a great experience, that can go a really long way. And when a faculty member doesn't need to know about 15 different services, they can actually do that meaningfully with one. So that's a quick answer, but Marybeth, if you have any suggestions there, I welcome your input.
Yeah, I mean, I agree that sometimes institutions have on their website a whole list of these resources, and it can be difficult for a student to trust them all, right? So I think, you know, choosing a service that that the institution really feels committed to and will promote, I think is very helpful. The other thing is word of mouth with students is very important, right? I mean, sometimes a student won't go to counseling the counseling center because they heard there's a wait list. I mean, there might have been a wait list a month ago. There's not a wait list now, but the student heard of someone who had a bad experience, right? So students are talking to each other. And so I think one thing that's very important is to get the voices of students out, talk to student government. If you have an Active Minds group on campus, get them involved. Make sure students endorse a lot of what you're doing because they are the customers here. So I think, student to student communication is really important. And, if you get off to a bad start with students, it can be very difficult to redeem yourself. So really think about how you launch these different services and really try to get buy-in from students and student leaders ahead of time, and really find some of those influencers on campus who can help you promote this, because as much as faculty and staff are trusted sources, many times their fellow students are even more trusted, people who've actually used the service. So I would start there.
But yes, and that as well. There are also extra capacity. So students in many things when it comes to student success are fantastic for you if you can, really leverage it. Don't expect them to do, anything outside of their abilities. But as Marybeth was saying, I mean, they're extra arms and legs in this story that they're going to help their friends. So, and they are keenly interested in these sort of topics. Again, we talked a little bit about how the Z's are, more attuned to this. Did you know the fastest growing major on campus right now isn't computer science? It's psychology. So there's clearly an influx here into this sort of thing. Leverage your students. They're super interested in this. They want to help each other and they want to learn about it as possible future professionals. So there's something there for you.
Yeah. And RAs on campus, the resident assistants, they would love to have a resource rather than just kind of calling the counseling center or 911. They would love to have a toolkit to help their fellow students. And if it works well, they will be your best promoters.
Absolutely. And I'm seeing that we could do Q&A sort of for the rest of the day. So I'm going to go ahead and call it there and say a huge thank you to both my co-presenters and everyone for joining. So thank you. Have a great day. Please feel free to follow up. We do mean it. We have our emails there. We are more than happy to answer any questions. So thank you, everyone. Take care.
Done.